Hello everyone. Today we are going to discuss about separation anxiety disorder. So, what is separation anxiety disorder? It is a disorder in which a child becomes excessively anxious when he or she is separated from the parents or known to faces or a personality. Children are especially very prone to separation anxiety during times of stress. When they are separated from the parents, children will be having stress and anxiety. So this is separation anxiety disorder. In that, child will be very anxious. Let's see the definition of separation anxiety disorder. Separation anxiety disorder accounts for approximately half of the referral among all anxiety disorders, usually diagnosed in infancy, childhood, or adolescence. Separation anxiety disorder is characterized by abnormal reactivity to real or imagined separation from attachment figures that significantly interferes with daily activities and developmental tasks. Age of onset. The onset is usually peaked between the 9 and 13 months of age and decreased usually after 2 years of age. And after that, what happens? After 2 years, the child will get an autonomy by the age of 3. Separation anxiety symptoms may increase again by the age of 4 to 5. So what happens between 9 months and 13 months? The anxiety is usually decreased, and after 2 years of age with increasing level of autonomy, and again they will get the anxiety when they started going to school by the age of 4 to 5. Signs and symptoms. The cardinal symptoms is a significant distress or excessive and unrealistic fear upon separation from parents or the home. Now what is cardinal? Cardinal is fundamental, something basic. The child worries that something may happen to his parents. Example, that they will disappear, get lost, or forgot about him. Or the child will get lost, kidnapped, or killed if he is not near his parents. Child will feel that unrealistic fear that something will happen to him or his parents when he or she is not around the parents. Now we will be seeing behavioral symptoms. What are the behavioral symptoms will be there? Crying, clinging. Clinging means when you are too dependent on someone emotionally, that is clinging. Complaining upon separation, searching or calling for the parents after their departure. Next symptoms is physical. What are the physical symptoms a child shows in separation anxiety disorder? Is headache, abdominal pain, fainting spells, light headachehness, dizziness, nightmares, sleep difficulties, nausea, vomiting, cramps, muscle ache, and palpitation and chest pain. Next, what are the common situations? Common situations, in what situation separation anxiety symptoms appear in child? So whenever child is left at daycare, enters the school, gets on the school bus, being bullied, is left at home with babysitter, begins summer camps, moves households, stays overnight with friends or relatives, confronts parental separation or divorce, and change of school. So in these situations, a child may have anxiety. According to DSM-5 criteria, presence of at least 3 out of 8 possible anxiety symptoms that appear during separation situation. Separation from home or from major attachment figure, fear of losing or possible harm befalling to major attachment figure, refusal to go to school or to be alone or with major attachment figure, etc. Symptoms must be present during at least 4 weeks and must started before the age of 18. The symptoms, whatever child is showing, it has to be last till 4 weeks and it has to be before the age of 18 years. Symptoms cause clinically significant level of distress or impairment in social, academic, occupational and other areas of functioning that is not explained by another disorder. So these are the DSM criteria. What is comorbidity? Children with separation anxiety disorder more frequently present also with major depression, bipolar disorder and attention deficit hyperactivity disorder, which is called ADHD. So if patient is suffering from separation anxiety disorder, they might have major depression, bipolar disorder and attention deficit hyperactivity disorder, and girls with inattentive subtypes of ADHD may have higher rates of comorbid separation anxiety disorder. Prevalence and epidemiology. Separation anxiety disorder is probably the most common childhood anxiety disorder, with prevalence of 3 to 5% in children and adolescents, and is decreased with increasing age. As soon as a child is growing up, this anxiety will be decreasing. Furthermore, almost all of the epidemiological studies that have been conducted so far have yielded that girls have higher rate of separation anxiety disorder than boys. Etiology and pathogenesis. The etiology of separation anxiety disorder is complex and partially unknown. Studies demonstrate that both biological and environmental factor plays a role. Environmental factors might have a stronger influence in separation anxiety disorder than in other childhood anxiety disorder. There is a broad agreement that an interaction between different factors, biological and environmental, increases the risk for anxiety disorder. For example, the interaction of a mother with a low anxiety tolerance and a child with behavioral inhibition is likely to result in anxiety in the child. Next, we are going to see biological factor. In that, first is genetic factor. A large-scale twin study suggested a significant genetic influence for separation anxiety disorder, accounting for heritability of around 73%. Most studies suggest anxiety disorder runs in family and that a person can inherit vulnerability for any anxiety disorder. Children with anxious parents are 5 times more likely to present an anxiety disorder. It means if parents are anxious, there are chances that the child may also have the same symptoms. Next, we are going to see is psychobiological etiological factor. Psychobiological process such as fear conditioning are the underpinnings of anxiety disorder. These are the product of genes and environment on the functioning of brain regions involved in fear and reward circuits. Dysfunctions of some brain areas. The amygdala is one of the main areas implicated in the anxiety. Environmental factor. We have seen genetic factor, biological factor. Under that genetic factor, now we are going to see psychobiological. We have seen dysfunction of some brain areas. We have seen. Now we are going to see environmental factor related to the child's family. Factors related to child's family that can cause anxiety includes low parental warmth, parenting behaviors that discourage child autonomy, overprotectiveness and over-involved parents, severe parental discord, separation or divorce, physical illness in parents, and mental disorder in a parent, such as panic disorder and major depressive disorder. So these are the environmental factors which causes anxiety in child. Early experience, stressful life events are broadly associated with pediatric psychopathology in general, being involved in a major disaster or crime. If child is involved in major disaster or crime, that may also produce an anxiety. Exposure to family violence, parents losing a job, and birth of a sibling. If birth of sibling is like parents are not able to give that much of time to the other one. Next, related to the school, being bullied and failure to perform at the expected level in exams, sports, or other academic activities can also play a role in developing separation anxiety. Now we are going to see the treatment. We have seen the symptoms, etiological factor. Now we are going to see the treatment. There are multiple treatment options for children suffering with separation anxiety disorder. Most effective treatment refer to non-pharmacological treatment, psychoeducation, behavioral intervention, and different form of cognitive behavior therapy. So let's discuss psychoeducation. What is psychoeducation? Educating the family and the child, increasing insights and motivation. When you teach a family and child, it increases the insight towards particular thing, how to reduce the anxiety, and it motivates the family members that they give a proper time to a child. Understanding the nature of anxiety and how it is experienced by the child will help parents and teachers sympathize with a child's struggle. Psychoeducation should always cover anxiety as a normal emotion at all developmental stages, factors that may trigger or maintain anxiety symptoms, natural course of separation anxiety disorder, treatment alternatives, including their advantages and disadvantages, and prognosis. Next, behavioral interventions. So in behavioral therapy, we can give systemic desensitization, flooding, impulsive therapy, contingency management, and modeling. First, we will be seeing systematic desensitization. What happens in systematic desensitization is it involves teaching relaxation methods to reduce their anxiety sensation and exposure to progressively more anxiety-provoking situations. The least of intense situation is collaboratively produced by the therapist and anxious child. For example, a less intense but still anxiety-provoking situation that children with separation anxiety disorder might confront is being separated from their parents for 10 minutes while in their familiar house. So we are separating the child from the parents, but in their own house, familiar house. A more intense situation might consist of being separated from their parents from longer period while away from the home in unfamiliar environment. So this is systematic desensitization. We are separating parents and child first in a familiar environment. Then if we wanted to increase the intensity, we will be choosing unfamiliar environment so that we can reduce the anxiety step by step. Flooding therapy, it involves continuous actual exposure to the provoking situation. In this procedure, a therapist provides the anxious child with a sudden intense exposure to a feared situation. Child may initially very anxious but eventually habituate and calm down, having survived an experience of intense fear and living through it. The children learn that nothing bad has happened to them despite their fears. So in this, what happens? A therapist provides a sudden anxious or intense situation which causes fear and anxiety in the children. So eventually a child will calm down and he will think that nothing has happened with the situation. Nothing is wrong with the situation. So step by step again we can decrease the anxiety. So let's see the example. A child with separation anxiety disorder may be forced to go to school for a full day regardless of attempts to resist separation from caretaker. Contingency management. Contingency management is a form of treatment to be effective for younger children with separation anxiety disorder. Contingency management revolves around a reward system with verbal and tangible positive or negative reinforcement when the child displays separation anxiety. When children undergoing contingency management show symptoms of independence, they are praised or given a reward. For example, a reward may be given each day the child attends school or goes to bed alone. Like if a child have anxiety during going to school or sleeping alone, so when he performs the task, we have to give some reward, some positive reward to the child so that he can be motivated to do the same in future. So by the time his or her anxiety will be reducing eventually. Modeling. Modeling can play an effective role in management. Different modeling strategies used include live modeling, symbolic modeling, and participant modeling. In live modeling, another child displays successful separation from the parents. The child shows difficulty separating from parents, initially followed by gradual mastery. In participant modeling, the child with separation anxiety disorder repeats the model behavior after live modeling. In symbolic modeling, the therapist shows videotape of some other child's successful separation from parents. So it is nothing but whatever child sees that he follows. Treatment. Again, it's cognitive behavior therapy, which is called CBT, helps child in identifying anxiety cues and applying coping skills. According to Kendall, there are 4 components that must be taught to a child undergoing cognitive behavior therapy. The first one is recognizing anxious feeling and behaviors, discussing situations that provokes anxious behavior, developing a coping plan with appropriate reaction to situation, and evaluating effectiveness of the coping plan. Next is parent-child interaction therapy. It has 3 stages. Child-directed interaction, teacher parents to be warm and praiseful to promote the child's feeling of security in order to facilitate separation from the parents. Bravery directed interaction. The therapist works with both the parent and the child to develop a list of situations the child is fearful of or currently avoiding in order of severity. The family creates a reward list to reinforce the child's effort. And parent directed interaction. Parents learn how to manage the child's misbehavior based on operant principles of behavior change. Also, parents learn not to reinforce the child's anxious behavior. For example, not giving the child more attention when he skips classes. So these are the 3 stages of parent-child interaction therapy: child-directed interaction, bravery-directed interaction, and parent-directed interaction. Next, we are going to see the pharmacological treatment. Selective serotonin reuptake inhibitors, SSRI, antidepressants, tricyclic antidepressants, benzodiazepines, anti-anxiety drugs, buspirone, antipsychotics, if any psychotic symptoms are there, antihistamines, and melatonin. These are the drugs we use. Next is group therapy. It has shown a significant effect on reducing separation anxiety disorder in children, and an art therapy. It has also reduced the symptoms of separation anxiety disorder in elementary school boys while providing them with a creative outlet for their anxieties and emotions. So here I am summarizing my topic, separation anxiety disorder. We have seen the meaning of separation anxiety disorder. Then we have seen the definition of separation anxiety disorder. What happens? Separation anxiety disorder is nothing but characterized by abnormal reactivity to real or imagined separation from attachment figure that significantly interferes with the daily activities and developmental tasks. Next, we have seen the age of onset, at what age it starts. Next, we have seen the signs and symptoms. We have seen the behavioral symptoms, physical symptoms, in common situation, what causes anxiety in the child. Then we have seen comorbidity, prevalence and epidemiology, etiology and pathogenesis we have seen. In etiology, there is biological factor and environmental factor. In biological factor, we have seen genetic factors, psychobiological dysfunction of some brain areas, and in environmental factor related to the child's family or the experience related to the school. Next, we have seen the treatment. We have treatment is therapies, psychoeducation, behavioral interaction, and different form of cognitive behavior therapy we have seen. Then we have seen systemic, in that we have seen behavior intervention, in that we have seen systemic desensitization, loading therapy, contingency management, modeling, cognitive behavior therapy. Then parent-child interaction therapy we have seen. Then we have seen a pharmacological treatment, which includes selective serotonin reuptake inhibitors, tricyclic antidepressants, benzodiazepines, buspirone, antipsychotics, antihistamines, and melatonin. And at last, we have seen group therapy and art therapy, how it helps to reduce the anxiety in the child. So the most recent evidence which supports the treatment shows that cognitive behavior therapy and selective serotonin reuptake inhibitors are the most effective treatments which we can provide the children with separation anxiety disorder. So here we are completing our topic. Thank you.